From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
All right, ladies and gentlemen, thank you for joining us. We are here for another Live Desk Conversation here from the Wood TV Live Desk. My name is Luke Laster. Today I'm joined by Spectrum Health here as we head into the Christmas holiday. Jon Ashford, the COO of United Hospital and Kelsey Hospital, also joined by Dr. Josh Kooistra, Senior VP and CMO, Spectrum Health, West Michigan. Gentlemen, thank you both for taking the time today. I understand you're both very busy, but thank you for taking about a half hour here to answer some questions. How are you both?
Doing well. Thank you, Luke.
Yeah, thank you, Luke. Thanks for having us.
Excellent. So we'll get rolling here rather quickly. I do want to ask, just kind of as a starting point here, how are facilities holding up on Spectrum Health's side of things? We heard from the governor earlier this week that they are seeing a trend that they are satisfied with in terms of cases. How is capacity, things along those lines?
I'll be happy to answer that. So thankfully, we have seen a plateau and actually a little bit of a decline in the number of COVID-19 inpatients that we have across Spectrum Health. At the height of it a few weeks ago, we had, I think, around 360, 370 patients within our system. Today, we're down to 229. In addition, another positive thing that we're seeing is our testing percentage of positive tests. We were hovering around 20, 21% 2 weeks ago. Today, our 7-day average is 12.9%. So really looking like we're moving in the right direction in West Michigan.
And so, a big topic of discussion today is going to be vaccine distribution. Talk about that throughout Spectrum Health, just the network as a whole.
Yeah, I could take that question. So we received our first vaccine distribution this past Tuesday, and it's the whole process has been going phenomenally well. We were very quickly able to stand up our first clinic within a matter of hours to begin our first vaccination of our staff members, focusing on that phase 1A criteria. By the end of the week, we should be actually satisfied and done with our first initial shipment. So we're looking at approximately close to over 1,000 people being vaccinated within our system. Our team members have responded well, and I think, alluding to the sense of hope that this vaccine has truly provided our system and our team members is truly remarkable. And it's been a huge and great collaborative effort with the leadership and with the line level workers and those who are taking care of our community.
And with, Pfizer has been approved. If we see the approval of Moderna here, is that something, those numbers of getting those out to the healthcare workers, will that increase?
Yeah, so with the Moderna, hopefully we'll get some news today on their EUA and approval. Right now we're going to scale. I think the limiting factor for us is just the capacity and supply chain of the vaccine. And so we have, like I said, on that Tuesday, we have many people who are ready to react and really to put forth a great stand so we can do this with speed and efficiency and provide this vaccine to our healthcare providers.
So now that you have explained that a little bit, let's kind of dive into the vaccine itself. Can you just explain the overall safety of the vaccine? That is a common question that we're getting, just kind of a broad explanation of the overall safety of it.
So I can speak to that. So, although this vaccine was produced under Operation kind of Warp Speed, all of the necessary, processes to ensure the safety were followed by the FDA and by the manufacturers to ensure, one, that it's efficacious or works for the community, but also that it doesn't have significant adverse effects in the community. And so the study was done, initially looking at 38,000 patients, really reporting any adverse events with the placebo arm compared to the treatment arm. And all evidence is showing that this vaccine appears to be highly safe and efficacious.
And so one question we have, as I believe you gentlemen know, we put this out about 24 hours ahead of time. And one of the questions we received, we'll get into a few of them here. This one comes from viewer Michael. He asks, can you get Bell's palsy from the vaccine or other serious side effects?
Sure. As far as the Bell's palsy is concerned, there were 4 cases observed in the vaccine arm out of 18,000 people. And if you look at the the background rate of Bell's palsy among the community, that is not that different than what was seen in the vaccine arm. So although every adverse event is reported out in the patients that did receive the vaccination in the study, it would not be expected that there would not be 4 in that patient population that would get Bell's palsy. As an emergency physician, I see Bell's palsy in our community with fair frequency. So it's not something that's extremely rare. And in the majority of cases, most Bell's palsy does resolve.
Can you explain any other side effects? We know that there could be just, pain in the arm or some, nauseousness after the first shot. Can you explain just overall the side effects that may be felt after the first shot or the second shot?
So when we look at the side effects that people feel, most of them is injection site reaction, and that's some soreness that you would receive in your arm, typical of any vaccination, and that's seen in about 82% of people. The second most common side effect is fatigue, followed by headaches and just some generalized body aches. Most of these are mild, but most were more significant after the second dose of the vaccine than after the first dose. And I think that's just a reflection of your body having an inflammatory response to the protein that it's seeing for the first time.
Can you explain why would you encourage those who are maybe hesitant to get the vaccine?
Sure. One, looking at patients that I've treated that we've seen in the ICUs, although you may not be elderly or with significant comorbid disease, I've seen patients with COVID-19 that have been young, that don't have significant underlying comorbidities. And you never know if you're going to be one to get severe case of COVID-19 compared to the vast majority of patients that do very well with only mild upper respiratory symptoms. So for a personal reason, that's one reason why I would encourage people to take it. Secondly, I think, as we look at the community at large, really, if we can get 60 to 70% of our community vaccinated, that will instill herd immunity, and it'll protect our population at large. And so it will protect our loved ones that may be elderly or with comorbid conditions, and prevent them from developing severe illness.
Can you explain a little bit more, just elaborate on herd immunity? That's something we've heard since earlier in the year, and achieving that. Can you just explain how it is effective and what the benefits are of that?
So it really looks at community spread, and experts say you need 60 to 70% of people immune to a disease to instill herd immunity. And really that just is the theory that if the disease is out there and has the potential to spread, there's enough people that have immunity that it won't meaningfully or exponentially spread and eventually die off. We see this with measles and the vaccine, and as vaccination rates have dropped in measles in some communities, we've seen that disease start to rear its ugly head again.
We do have one question here. This came to us last night. This is from viewer Sue. She asks, my father is 97 years old and tested positive for COVID on December 11th. He fortunately has only mild symptoms, mainly a cough. He resides in a senior independent living community. Will he be able to receive the vaccine when it is offered in his community if he still has a cough?
So our guidance that we're giving our healthcare workers right now are that they must be resolved from their current illness. So I would say, if you look at CDC guidance, it's really 10 days after the onset of symptoms with improving symptoms and no fever for 24 hours. So that is kind of the guidance that I would give her father on when he would be eligible to receive the vaccine as a nursing home resident.
And then another big topic of discussion, a couple questions that we did receive was how long the vaccination lasts. Are there any answers at this time? And we know studies are, constantly being conducted, but do we know how long it will last? Will this be a yearly thing, or, how will that last?
So experts don't fully understand that yet, and time is going to tell. This initial study looked at a short window and did not look at the longevity of the immunity that the vaccination will give us.
And now I want to kind of hop into flu versus COVID right now. We would normally be in peak flu season. Can you explain the primary differences there between flu numbers and just, I guess, flu versus COVID at this time?
So if there's any silver lining to COVID-19 and the pandemic that we're in, it's that our flu numbers are almost non-existent. At Spectrum Health at Butterworth Hospital, we've actually been running a test on all of our inpatients and emergency patients for about the last 3 weeks that when you're tested for COVID also looks for influenza and respiratory syncytial virus. And of those tests, we have had, I think 0 have come back showing influenza. At this time, typically we would have, the start of our influenza kind of seasonal epidemic, and we have not seen any of that. I think that's due to social distancing measures, masking, good hand hygiene, and it's not unlike what was seen in the Southern Hemisphere over the summer with their influenza numbers as well.
Can you explain the, just the differences in testing when it comes to the flu versus COVID? We have one question. This is from viewer Cindy. She asks, will the flu make a COVID test come up positive, and would COVID make a flu test positive?
So the answer to that is no. There's no cross-reactivity between the tests. Both influenza and COVID-19 have both antigen tests and PCR tests. And they're a little bit different in what they look for, but essentially they're both looking for the same kind of genetic sequence or protein antigen that are kind of individual for whether it be the SARS-CoV-2 virus, which causes COVID-19, versus the influenza virus, which is completely separate, would have separate antigens and separate proteins and DNA.
And similar to those lines, you kind of hit on it just briefly a moment ago. This one comes from Jen. She asks, are you testing for flu, or is it all just considered COVID? I know you kind of hit on that a little bit, but if you could elaborate a little more.
So, as I stated, that 4-plex test that we're running at our busiest hospital in Grand Rapids does look for both influenza A, influenza B, COVID-19, and RSV. And it reports those each out as separate positive infections if they occur. And like I said, there's no cross-reactivity based on how the tests are performed. And so, it is up to the clinician. If I were to see somebody with fever and signs of COVID-19 and I had only one of those tests and I got a negative COVID-19 test, I would consider potential flu as an alternative diagnosis. And if I had the test available, I could get an influenza A or B test to evaluate for flu if the COVID test was initially negative. However, as I said also, we're fortunate in the community that we're seeing almost non-existent influenza right now. So the likelihood that that would be the case or the alternative diagnosis would be pretty low.
Is there anything, at this time that we haven't discussed, I guess, right now, that you would like to specifically tell the public in terms of any kind of misinformation that is being spread that can just be easily debunked at this time?
John, you want to take this one?
Yeah, so I think it's important. I think you hit it right on the nail on the head there, Luke. Misinformation, and there's a plethora of resources out there, and I think all of us advise to do your own research. And I think if you go to the Spectrum Health website, there's information regarding the COVID-19 as well that provides you links to the CDC guidance and website. Also, there's a collaborative effort with Spectrum Health, the health departments, and other health systems at the Vaccinate West Michigan, Vaccinate, WESTMI.com, where it has a plethora of information also located there for our community members. And I think that will ultimately be a great resource for our community to really gain the knowledge that they need to make their independent decision.
And we do have one viewer question here. This has popped up in our feed. This question is from Twyla. I'm going ahead and publish that one right now. Twyla asks, I work in the hospital. I have asthma, celiac disease, and seasonal allergies and allergies to fragrances. Is it safe for me to get the vaccine?
So I think that's celiac disease that she is referring to and some seasonal allergies, if I understand correctly. The only contraindication to the Pfizer vaccine right now that they're saying is really if you've had a severe anaphylactic reaction to another vaccine. And so seasonal allergies would not put you in that category. nor would allergies to like a food or a medication. They really say that it has to be against a vaccine that you've received before, and then they're asking you not to get the Pfizer vaccine at this point in time.
All right. Thank you, Twyla, for that question, and thank you for answering that as well. Before we do wrap up here, I always like to end on a good note. What can you tell me that is good at this time? We do have some light on the horizon, but want to hear it from you guys. What is something good that you could tell us at this time?
So for me, and then I'll let Jon answer, I think seeing the faces of hope on my colleagues that are receiving the vaccine, it truly is emotional and it's really special. We have some of our physicians got dressed up to the nines yesterday to come into the clinic to get their vaccine, and just to see their faces and the hope that they're seeing light at the end of the tunnel just makes all of the efforts that Jon and our teams have put in place so worth it. And we are hopefully able to extend this beyond just healthcare workers and nursing home residents and really make an impact for our whole community, so that we can get back to kind of life as we knew it.
Yeah, and I have to echo the same that Dr. Kooistra just mentioned. It's really the hope and the visual that we're receiving from our employees. This has been a truly remarkable process that we've indulged in, and to see all facets of our team come together to truly put forth and make this in a record-setting pace has been absolutely phenomenal. And they're excited. Team members are excited, and they're excited to help wherever they can. From the largest scale job, actually providing the injection, to the most minute, to sanitizing pens. And no one is serving to any task that's assigned to them. And that speaks to the culture of Spectrum. That speaks to the culture of healthcare in general, where everyone's kind of pitching in to provide help and support to help us get through this pandemic.
Gentlemen, thank you both. I do have one more question that actually just came in here through our live stream. This one's from Isaac. It asks, if someone gets the vaccine and are later exposed, does that make them potential asymptomatic spreaders?
That's a great question. And evidence suggests that even if you've had the vaccine, you can still be infected with COVID-19. It shows that the likelihood that you will go on to develop a serious illness is much reduced if you have been vaccinated. But we do think that people could potentially still spread. And that's why, even if you've been vaccinated, we're telling all of our teams it's equally important to continue to practice social distancing, continue to wear a mask when you're caring for patients and you're interacting with each other. And all of the measures that have been put in place, although are reduced because you have been all the measures that have been put into place need to continue, even though your risk of contracting COVID-19 is reduced. Developing severe symptoms of that are significantly reduced, but recognizing that there is still a small potential chance that you could be a carrier and spread it.
Isaac, thank you for that question, and thanks again for answering that one. All right, anything else? We'll wrap up here. Anything else that you guys would like to say just before? Thank you. Also, I didn't get a chance there for saying something good about it. It's always nice to have some kind of light there at the end of the tunnel. But anything else that you guys want to add?
Just thank you to the community for their support of healthcare workers through this time and the care that we're giving to one another. And just ongoing grace as our teams are tired, but putting forth their best efforts, and just a sincere thank you.
Yep, and I say the same. Thank you, and please, as Dr. Kooistra alluded to continue to practice our social distancing protocols, guidelines for community members, and we can stop this spread, and we can do this together.
Awesome. Thank you, gentlemen. Have a great afternoon, and thank you for tuning in again. This was another live desk conversation here with Spectrum Health today. To both of you, thanks again, and have a great afternoon to the viewers.
Thank you.